Welcome back to Family Foundations for Optimal Sexual Development. Want to quickly review last session, The Body Speaks, which was about optimal sexual health. And inside that fireplace of lifelong loving marriage, that is the best place for sexual fire to take place between two people. And we let the body speak to us what those two people should be. Based on the reproductive system, one male and one female completes the reproductive system. And all the words that you see in green there, they all point to lifelong loving marriage as being the best place for sex. And then we took a look at the bricks of the fireplace of lifelong loving marriage, and those bricks are the marital unions. You'll see mental, spiritual, emotional, relational, familial. Go back to last session to review all of that. That's what keeps the relationship strong, the marriage strong, which allows sex within that fireplace of lifelong loving marriage to be safe and protected. And with safe, protected sex comes a lot of rewards and benefits. And you can review those with your children on the right side. Because if sex gets outside of the fireplace of lifelong loving marriage, it leads to a lot of sexual risks, physically, emotionally, mentally, relationally, all sorts of things on the left side. So that's kind of the jump start into today's session, which looks even more at youth risks of sex outside of marriage.
So this is session 4, the risks of youth sex. Here's where we're going to go in this hefty session. We're going to look at the physical risks of youth sexual activity, including pregnancy, sexually transmitted diseases, also called sexually transmitted infections. And then we'll look at a whole host of other risks that come from youth sexual activity: relational, psychological and emotional, academic and economic, crime, victimization and risk behaviors, and how they affect on up into adult relationships as well. So we're going to jump right in, and let's take off with pregnancy. Teen pregnancy is a major public health problem and has been for a long time, a concern of many. There are about 13,000 teen births per year. That is a number that has declined significantly, but still a major issue. When we think about consequences for teen mothers, high rates of mental health problems, substance abuse, repeat pregnancy, domestic violence. We also see lower self-esteem, socioeconomic status, and educational attainment. We see also consequences for the children that are come from teen pregnancies. Premature death or birth or low birth weight are among them. Cognitive and speech delays as they grow, higher risks of accidental injuries, and so on from there. So the question then becomes, who would be at risk for becoming and facing a teen pregnancy? This could be a girl getting pregnant or a boy getting her pregnant. We tend to see youth who obviously are engaged in sexual activity are more likely to get pregnant. We also see siblings of youth who've had a teen pregnancy come along, children in a family with lower socioeconomic status. Again, as we've said before, these are not absolute determinants of a teen pregnancy, but some of the overriding and consistent characteristics of those who face a teen pregnancy. Teen pregnancy is a major concern, one I think many people are aware of. For this session, we've chosen to spend a lot of our time on a problem I think many are not as familiar with or as aware of the most recent data, and that is on sexually transmitted diseases or infections. You really can use those acronyms interchangeably. STDs or STIs are both medically accurate terms. One really isn't better to use than the other. You'll see we use them interchangeably. But when we look at the STD problem, for this session and for simplicity's sake, as we've said before, we want to help you understand the information so you can pass it to your children well. There are 3 overriding categories of STDs: bacterial, viral, and parasitic. And we'll look at those that young people are most at risk for. The 10 that are here: chlamydia, gonorrhea, and syphilis, HPV, HSV, HIV, HBV, and then we'll look at several of the parasitic infections as well. What I want you to see, first of all, though, is what an increasing problem we have. I mentioned pregnancy rates and birth rates are going down. STDs, on the other hand, are increasing. So here's a percentage change relative to the reference year from 2010 up here in Canada. And you can see the overall infections of chlamydia and then gonorrhea, and then, wow, look at syphilis as well, going all the way up. Big increases recently. Take a look at how it looks across age groupings, and you'll see those 15 to 24-year-olds account for about half of the reported chlamydia cases. And that's a big number as we think about overall lifespan, that the biggest risk is young people. And then this slide shows the steadily and significantly increasing rates of chlamydia over time in Canada. And you can see, as we've overlaid the year 1997 when we began teaching condoms here in school, the rates have continued to go up. Here's another chart showing that from the Public Health Agency of Canada. You can see down at the bottom the national rate, but take a look at those between ages 15 to 19 and 20 to 24. Those rates climbing all the way through. We have a major public health problem. A couple of things about this disease. Chlamydia is a silent disease. Rates are often underrepresented, so what you see here is really more likely to be much greater numbers. Most people who are infected are asymptomatic. Thanks to COVID, people have an understanding of what asymptomatic means. No signs or no symptoms, yet still contagious. And we want to help these concepts get across to our young people who already have a sense of being, they are not susceptible to disease or risk. They want to think that they can take risks without any consequences, and that's just not the case. So as we come back and look at the list, and we are going to go through these one at a time and give you an overview of the kinds of symptoms and complications and prevention methods related to each of these. This slide represents those that are curable versus those that are treatable, and that's an important difference. So bacterial infections are curable. They can be treated with antibiotics, but you have to have known you have the infection and go in to get that treatment and that cure to take care of it, and that doesn't take care of damage that may have been done while you were infected. So chlamydia, gonorrhea, and syphilis are curable infections. There in the middle, though, notice the difference when we talk about viruses. They are treatable. We can help reduce some of the symptoms, but they are not curable. There is no cure for any viruses, and there's no cure for sexually transmitted viruses. So we'll look at those. And then I want you to see over there on the parasitic infections, those are curable as well. And there's several different treatments depending on the infection there. So as we look at an overview of the current impact of STDs and STIs on young adults, I want you to know that there is an array of physical or pathological manifestations, which means there are a lot of complications that can come in the present time zone. Although most people are asymptomatic, those who do experience symptoms can have infestations, skin lesions. These are clinical terms. Infection of the urethra, cervix, or endometrium, or pelvic inflammatory disease. I'm going to show you a little bit more about that. But along with these physical complications can come great emotional and mental health impact as well. So here's a website, actually interesting. There's become such a resource online for those that have STIs. This is an online STI support group and a discussion community that's run by the American Sexual Health Association. Here's a posting from earlier in 2024 where this young person posts, "I have been going through it mentally with this diagnosis of HSV herpes simplex virus." And it reads, "What makes it worse are the outbreaks. I've been getting them every menstrual period for some reason. I contracted the virus from my ex-boyfriend that I was dating for over 2 years because he was cheating on me with multiple women. I also have bad side effects with Valtrex and am currently dealing with an outbreak without medication, just lysine and tea tree oil. It really sucks and my self-esteem is so low. If there's anyone out there in a similar situation as me, I would love to talk and support each other as it's hard for me to open up with my family and friends, and I just want someone to understand my situation." Heartbreaking to be dealing with this virus and its complications for this person. And I think we've got to keep this in mind as we go through some clinical explanations of these diseases. So here we go. Further along then would be an impact on pregnancy and the baby's transmission. We'll look at that for each of these specific diseases. And then there can be an impact with a sexual partner transmitting and putting that person at risk. That can affect the relationship as well with trust and stress. That's the short-term or current impact of these diseases. Let's take a look at the long-term, the future impact, and what can happen down the line when youth or young adults are infected. Pelvic inflammatory disease or ectopic pregnancy and infertility. Not being able to have a child when you want to have a child is a real risk, and we'll look at the specific diseases that affect that. A number of different cancers, chronic illness, work incapacitation, or relationships and school achievement as well can all be affected by this rampant epidemic of STDs. So let's walk through these. I'll go through quickly to give you an overview of each of these diseases. We'll start with bacterial and go from there. I'm hopeful you'll think, wow, I didn't know this. I'd like to learn more. And I'll give you some resources to look at to be able to learn more. Let's look at chlamydia first. Chlamydia can be called the fertility thief. It is the most common notifiable STD with the highest rates reported of young girls ages 15 to 24. Symptoms are not usually detected. That's that asymptomatic word there. But while it's inside and infecting the body, growing inside, that untreated chlamydia can result in PID, which can be a major cause of infertility, ectopic pregnancy, and chronic pelvic pain. Now, as I go through these slides, I should give a disclaimer that we have chosen to bring some of the images, the pictures that represent these infections, and you'll know they're coming when you see the 4 stars in the bottom right corner of the slide. So if you're a person who's pretty queasy or sensitive to some of these kinds of images, you'll want to turn away, and I'll go through them quite quickly. But first up is taking a look at what chlamydia does to the cervix. So the cervix on the left is a normal cervix. It is the entrance into the uterus at the top of the vagina there. It is the entrance into the cervix where sperm has to pass through to get up to an egg to fertilize. On the right, you see one with severe chlamydia. What has happened here? Well, that bacteria has come and gotten settled in this part of her body and has created swelling and pus and infection that have virtually blocked that cervix shut, making it impenetrable by sperm. This next slide shows the internal reproductive system of a female, what a healthy female should look like on the inside. And I want to explain to you what we're looking at so you can get oriented, and then I'll contrast this healthy female with one who's had a long-term infection with chlamydia. So here we go. First, you'll see there the 2 circles around the ovaries where eggs are stored. And then from there, branching down are the fallopian tubes that then lead into the uterus. They're in the middle, normally about the size of a fist, but that's where the baby will implant and grow. So for fertilization to occur and a pregnancy to begin, an egg is released from the ovary and travels into the fallopian tube where it typically meets the sperm, and then it travels on down there into the uterus where it will implant and grow for the term of the pregnancy. So next slide shows a very different set of reproductive organs inside this woman that had been dealing with chlamydia for quite some time. We know the doctor who took these images, and he said he had treated her repeatedly trying to get this chlamydia infection out. Let me show you what you're looking at here. You can see the uterus there, but then check out the fallopian tubes there. They are much longer, they are distended, they are swollen. What they did as part of a test is they injected dye up into that uterus. The dye should have flowed through the fallopian tubes and out at the end before they got to the ovaries. This dye, the black area that you see there, the black ball, is really the dye that was stuck at the end of the fallopian tube as part of this test. So the fallopian tube is blocked shut. So if the dye can't get out of the tube, how is the egg going to get into that tube where it needs to travel to get fertilized? The doctor said she will likely never be able to carry a baby, get pregnant on her own. And after months of discouragement and thousands of dollars spent trying to get pregnant, this couple was unable to do just that. So that's chlamydia. We'll look a little bit about how chlamydia can infect males as well, and the image on the next slide shows how epididymitis comes along and can infect the epididymis, and the testes as well can be swollen and infected by that bacteria, and then as the statement is made here, can lead to dramatic genetic damage in the sperm, leading to male infertility as well. That's chlamydia. Let's take a look at gonorrhea. Gonorrhea we remember as being resistant to treatment, meaning that it's getting harder and harder to knock this bacteria out because the bacteria are getting smarter and smarter as it's become so pervasive and hard to treat. A couple of facts here about gonorrhea. It is the second most common notifiable condition past chlamydia. In 2020, about half of all infections were estimated to be resistant to at least one of the antibiotics. It's more likely to cause symptoms in males than in female, and it can be, though, a major cause of PID, similar in its impact as chlamydia. The third bacteria we'll look at is syphilis. Thinking about it presenting in stages. I think syphilis and stages both start with S and how I remember and keep them straight. There are 3 phases to syphilis. The first stage is the appearance of a chancre. A chancre is a red sore that appears, can even be dismissed, or may not even be noticed for a bit before it goes away. And then later, a second stage can advance where there's a skin rash and flu-like symptoms. Then it can go latent for many years where there are no signs or symptoms. And then rarely, after 10 or 30 years, it will enter that tertiary side, which can affect, once it's acquired, symptoms can vary depending on which organs were affected, kind of attacked by that bacteria. You'll see those 4 stars there, so it's time to look at some slides. These are several pictures in different parts of the body where those syphilis chancres first appeared. And then you'll also see the rash there in hands and hair from that second stage as well. Syphilis, you may remember from our slides earlier, is growing at the fastest speed, increasing at the highest rate of all of the STDs. What's even higher than the rate among young people is the rate among babies. So this slide addresses syphilis during pregnancy. Syphilis can be transmitted to an unborn baby by its mother. The disease is called congenital or newborn syphilis. It can be linked to premature birth, stillbirths, and even death shortly after birth. You will notice on many of our charts when you look up congenital syphilis, it is increasing the fastest, sometimes over 200 or 300% year after year. In fact, here's a quote from Canada that the syphilis cases in babies has skyrocketed amid healthcare failures. That came out in March 2023. So we've got a big problem there. I feel like this is a lot of bad news and heavy content to share with you, but I do want you to know we're going to get to the prevention side of this as well. Those are the 3 main bacteria. We'll look now at viruses as well. The first one will be human papillomavirus, or HPV. It is the cancer-causing virus. There are over 100 different kinds of HPV, and it is by far the most common STD in the population. The quote here from the United States Centers for Disease Control says nearly everyone will get HPV at some point in their lives. Most of those will go away on their own. The problem is the ones that don't, and you don't know if the kind you get will go away on its own or if your body will be able to pass it or not. So when we think about HPV, we're going to look at 2 different major concerns. Before I go on to the warts and the cancer, I want you to see here that in Canada, HPV causes about 1,422 cases of cervical cancer in women and 637 deaths. So again, 2 major manifestations with HPV depending on the strain. Some strains can cause genital warts. 90% of them are caused by HPV type 6 and 11. They are not cancer-causing. They instead can cause these warts. So the warts can appear anywhere in the skin of contact in the sexual area of the body. They usually need to be treated. They don't go away on their own. They can be burned off or frozen off or removed with a laser. Here's those 4 stars. So I've got some pictures here in males of some of those warts and what they look like on the right, and female on the left. Again, those warts have to be removed, and to me there's an emotional side to this as well. on all of that. So looking at the cancers that can be associated with HPV, almost all cervical cancer is caused by HPV, but then you'll see in the research a list of different kinds of cancers: anal cancers, vaginal, vulvar cancers, and oropharynx. That's the mouth and throat cancers that are also linked to HPV. It is a difficult one for sure. So next up, we have another virus, genital herpes, which we'll remember as having an outbreak cycle of sores that appear on the skin and come around. So the most common symptom will be painful blisters on or around the genitals, can also be the rectum or mouth, depending upon contact. The first outbreak is often longer and more severe than the future recurrent outbreaks that can come. So those blisters will begin to tingle or burn on the skin and then sort of erupt on the skin. There can be a couple of them, there can be many of them. They will fill with fluid, which can be quite painful. That fluid will eventually burst and begin to ooze, and then those sores will dry up and go away. The problem is they can always come back, and they often come back at an inopportune time when your immune system is down or you're having other stress in your life, and that can be a perfect time for a herpes outbreak. It is a virus that is not curable, treatable. Those sores can have some medicine to help them feel better, but the cure is not there, and you will likely have those outbreaks on and off again for life. Here's those 4 stars, and here's what herpes blisters look like in a male. Those are very painful sores there on the penis. A little bit more about herpes. They can be transmitted even before there are signs of infection. That's called shedding, viral shedding there on the skin. And when skin contact is made in that part of the body, the herpes can certainly be transmitted. As I said, there is no cure. There are medications that can help, but occasionally there can even be rare or serious complications like forms of meningitis that can come along with herpes. We'll also bring up herpes about pregnancy again as well. The risk for the transmission to the baby is high and can cause some serious complications. Usually if they know the mother has herpes, they'll take the baby C-section and not risk the exposure of the baby to the virus as it passes through the birth canal. You can read some of the complications there about newborns and their kinds of risks to their different body organs as well. Next virus is hepatitis B and C. They damage livers. They are the liver damagers. We mentioned them here for several reasons because they're not often considered in the group of sexually transmitted diseases, but they are spread sexually. 4 in 10 of acute hepatitis B are acquired sexually. There is a vaccine for hepatitis B, but not for C. And you can see that it can become chronic, and people are likely to die prematurely from cirrhosis or cancer of the liver. Moving right along, you probably are familiar with HIV, the human immunodeficiency virus, which is a life changer. There's quite a lot of information out about HIV. HIV is the virus which is transmitted through sexual activity, which can lead to AIDS or acquired immunodeficiency syndrome, the most severe stage of HIV. People with AIDS have badly damaged immune systems and can become susceptible to other kinds of illnesses or opportunistic infections that are there. About 1 million people are dying globally because of HIV, and in some countries it's even the leading cause of death. I've got some images to show you there. Let me talk to you about HIV a little bit more. Heterosexual men are about only 7%. Heterosexual women about 16%. Most of it is going to be among homosexual men having sex with men. But I do want to explain to you what a co-infection is, or a syndemic, where the risk of one STD multiplies the risk of HIV because of several reasons. It may be because of those lesions, can be entrance points because of with the HIV, or maybe because their body is just more susceptible to HIV infection as well. So often they have 1 or more STDs going at a time. HIV can be spread to babies during pregnancy, and we're going to always be tested and watching out for that as a course of prenatal care as well. You've most likely seen commercials on, they're very popular now, or billboards advertising HIV medications. And just to sort of explain what those medications do, they're trying to reduce the amount of viral load in your body. It's called antiretroviral therapy. There is PrEP, which stands for pre-exposure prophylaxis, which people can take before their risk of exposure to sex or infection drug use as well. PEP is post-exposure prophylaxis. I read these in a way that makes them sound simple, and the commercials make them sound simple, but as we said, HIV is a life changer. These medications can be very expensive. They can be hard to get depending on which area you are living in. Your insurance may or may not cover it, and you will take them likely for life if that is your risk and lifestyle. So that's PrEP and PEP, not a simple solution to a life-changing infection. Those rates are going down. They have gone over time for the last 30 years since HIV was first identified. This is a chart from around the world through 2017, but you can see at the top number going up, of course, would be cumulative, the number of people who are living with HIV. That number is going up, but the other two numbers, the red showing new infections and then the black showing deaths, those numbers are going down. It continues to be rather regionalized in terms of where the location and greatest risks are there. You see them in the Central and South African countries especially as well, though spread across the world as well for risks. I wanted you to be aware of that with HIV. A lot of people know about HIV and think about it. Part of what I'm trying to do is help you see there are many other STDs to be worried about as well. The last category we have to look at is parasites, the parasitic infections. The first one is trichomoniasis. It is not a harmless infection. It also increases transmission and acquiring of HIV among women. It is a nuisance, fairly common infection, but it also, like chlamydia and gonorrhea, can have the risk of PID and resulting infertility. Most people do not have symptoms, although there can be some discharge for males and females, some itching or irritation, but it's very common, trichomoniasis, very common. And then two more are scabies and pubic lice, which are itchy and irritating little microorganisms that can land themselves in the genital area of the body. They can be treated along the way. There can also become sometimes infections from the itching that can occur. So those need to be treated. They're sometimes called crabs. A whole host of infections or diseases that sexually active young people are at risk for. And I want to make a couple of comments as we shut down. As I said, also, I want you to want to learn more about these STDs. I hope this was some new information for you. But I want to address the question of why adolescents are uniquely at risk. So first of all, as we've mentioned before, their brain is still developing. Their prefrontal cortex, where their executive function is, they're just not making the best decisions. They're just not able to fully consider consequences when they're making short-term decisions. That's a big part of it. The second part is they are more likely to engage in high-risk sexual behaviors. That's having partners at the same time, concurrent partners or multiple partners, or not using any form of risk reduction. We also see that they're less likely to use health care, to get testing, to get treatment for those infections. And then an interesting part biologically is that adolescent females are more susceptible to STDs because there is a lower production of mucus around the cervix, which is a protective factor, that mucus is. And then their cells are still developing there. They are more susceptible. They don't form as strong of a barrier as an adult cervix does as well. So the bottom line in all of this is that adolescence has a much higher chance of getting exposure and a lower chance of getting screened or diagnosed or treated for the STDs. And that's why we see this problem continuing to go up for young people. Sex today for young people is much riskier than it was prior. Let me spend a few moments talking about condoms, really the only solution for risk reduction of the STDs. We want to talk about prevention in terms of primary prevention, and then this would be a secondary prevention for those that are sexually active. The cultural message is just use condoms and you'll be fine. And I want to make sure you're equipped with the best information that says how effective or how not effective condoms are when it comes to STD and STI transmission. So when we think about sexual activity, there are several ways that these diseases are spread. That could be through body fluids, skin-to-skin contact, or even rarely through deep kissing as well. So condoms are intended to provide a barrier there and prevent that exposure through fluids or through skin contact. So here's straight out of the United States Centers for Disease Control off of their website, their most recent statement on condom effectiveness. I use this slide a lot to kind of break it down. It really comes down to the amount of protection is based on the way the disease is spread. So let me just read these statements to you. Consistent and correct use of latex condoms reduces the risk for many STDs that are transmitted by genital fluids. So if it's through fluids, and we see that's chlamydia, gonorrhea, and trichomoniasis, then we see reducing the risk. Second statement, consistent and correct use of latex condoms reduces the risk for genital ulcer diseases like herpes, syphilis, and chancroid only when the infected area or site of potential exposure is protected. So now there's a condition. If this is a skin disease, a lesion, that's what a genital ulcer is, those sores on the skin. If it's that kind of disease, then only if that infected area or site of potential exposure is covered. Here's the problem. Condoms don't cover all of the skin in the sexual area of the body. HPV can live on the inside folds of the legs. Well, condoms don't cover legs. So you see the condition here for risk reduction. The third statement here, consistent and correct use of latex condoms may reduce, notice the change, the risk for genital HPV and HPV-associated diseases like genital warts and cervical cancer. We've gone from reducing the risk with a condition, to may reduce. I mentioned to you earlier, HPV is the most common STD among young people today. And we see that there's the least amount of risk reduction with condoms. But the key on all three of these statements is the beginning of the statement, where it says consistent and correct use. Consistent and correct use doesn't really go along with teenagers. They are risk takers. They are often having unprotected sexual activity. They may be under the influence of drugs and alcohol. They simply are not using condoms in a consistent and correct way. But even if they did, we still have this lowering of the risk reduction, which is an increase of the risk for the various diseases spread through fluids and skin disease. That's what this next chart represents. You can see the 4 STIs that are transmitted through bodily fluids. There's a moderate risk reduction. And then the 4 that are transmitted through contact with skin or mucous membranes, some risk reduction. And then again, in the bottom with HPV, there really are no conclusive studies that let us know how much risk reduction is there for HPV, the most common STD among teenagers that can lead to warts and cancer. This slide summarizes those kinds of numbers of risk reduction, again with consistent and correct use of condoms. Well, kids think, well, we just use condoms, but they don't really understand how technical correct use of condoms is, and that's on this slide here. I won't read all of these steps. The second one, for example, says if the condom does not have a reservoir tip, pinch the tip enough to leave a ½ space for semen to collect. Holding the tip, unroll the condom all the way to the base of the erect penis. That's very technical to get correct use, and again, teenage brains, often under the influence of hormones or also drugs and alcohol, are just not able to follow all of these steps that are technical, as you can see. I once saw a popular school curriculum that had 15 steps to using a condom properly. This is hard to achieve with young people. I want to make a comment, though, to let you know that Planned Parenthood and others in the comprehensive sex education movement would like us to believe exactly what's on their social media post here, that STIs are normal and common. They want to minimize their effect. They want to minimize if perhaps we're talking negatively or even making someone who's infected feel ashamed. It's not that at all, but we recognize STIs are a serious health concern that can and should be avoided, a different approach than those who are minimizing them as just normal and common.
Thank you, Lori. Lori covered all the physical risks. But research tells us that even if a youth does not become pregnant or acquire a sexually transmitted infection, they are also subject to many other risks, such as relational risks. Youth who are sexually active are less attached to their parents, school, and faith. As a result, they're more likely to run away. Youth who engage in sex early in their lives have early failed relationships, which can often lead to a pattern of failed relationships in life. And as a result of beginning to have sex early, they'll end up having more sexual relationships and more sexual partners. There are emotional risks for those youth who are sexually active. Research shows that single teens who are not involved in a relationship are the least depressed. Those in committed or going steady relationships are moderately depressed. And the youth that are in the highest depressed levels are those who are in hookup relationships. Parents, you need to be aware of this. When it comes to the academic and economic risks that Lori and Dave related to earlier, youth who are involved sexually have lower educational achievement and reduced earning potential. Why is this? Dave talked about the success sequence. Success sequence tells us that if youth follow a 3-step process, first they go to school, then they finish school and get a job, and then they marry before having children. If they follow those steps, they have a less than 3% chance of ending up in poverty. But if they don't follow any of those steps, then they have a 53% chance, or 53% of the youth who do not follow those steps will end up in poverty. Youth who are sexually active are more exposed to crime. They're more likely to engage in smoking, alcohol, drugs. They have an increased risk of sexual abuse and sex trafficking. Here in Canada, we often think that the girls involved in sex trafficking come in from other countries. But the research shows that 84% of sex trafficked girls here in Canada are Canadian girls. And 27% of those girls are 17 years of age or under. And the average age of recruitment into sex trafficking here in Ontario is only 13 years of age. Adulthood relational risks. When you ask the kids, when kids are surveyed about what are their desires, the majority say they desire to have a lifelong married relationship. Unfortunately, engaging in youth sexual activity often leads to reduced satisfaction and stability in marriage and contributes to divorce. Why is this? Well, as Dave said in his session, sex is like glue for marriage. When we engage intimately with our partner, bonding hormones are released that want us to stay together. But the research shows, if we have multiple sex partners, it makes the bonding difficult. However, those who wait have higher relationship satisfaction, better communication skills, less divorce, and yes, even better sex. So, is youth sex a risk? Absolutely. We've gone through the physical consequences, the social, emotional, academic, and economic consequences, and these can be lasting generational consequences. However, if we can use the tools that we're providing you with to help our kids embrace the future and protect their future, youth who avoid non-marital sex have improved mental and emotional health, family and social relationships, academic achievement, earning potential, and yes, even reduced exposure to drugs, alcohol, crime, etc. These are lasting generational blessings. Well, that's the end of this session. Here's your homework. It would be a good idea to read and research more about STDs and STIs and prevention. Share with your youth the information that you've learned and bring it back to the context of what is God's loving plan. Lastly, plan a fun family activity to do together, to connect with your children. Or better yet, let the kids plan the fun family activity. Thanks so much for joining us during this session. We look forward to seeing you in session 5.